So I'm a youth and family practitioner.
I'm a GP registrar.
I'm an administration officer for corporate support.
So I am the practice manager for Mackay Family Health, communications and project development officer.
My position is Cape York ITC program lead.
I work in the Tackling Indigenous Smoking team.
My position at Apuna Pima is the health promotion lead role.
I'm the workforce training coordinator for the elder care support program.
My role is human resources at Apuna Pima Cape York Health Council.
So as a youth and family practitioner, our role is to engage with youth who have been referred to our services, either through education, youth justice and child safety services, or families who have self-identified as needing support. That is to empower and educate our young people through positive mentoring, behavioural programs, activities, education, and holistic intensive support, thus enabling our young people to begin to make the right decisions at home and in community.
I deliver quality administrative support to our different departments within the Barmer House, and that includes human resources, information and technology, quality and compliance, and communications and marketing.
As the practice manager, I oversee the day-to-day operations, the smooth function of the clinic.
Yeah, so for communications and stakeholder engagement, I try to keep in contact with all our partners and stakeholders and keep them updated on the work we're doing. And that's a real, the core work that we do is the health workers. It's the accommodation support workers, it's the cleaners, it's the cooks, it's the staff who are on the ground every single day doing their best to improve the lives of others. And the fact that I get to share those stories and promote that to others to hopefully get more people involved, raise awareness, that's really special. So sharing stories, engaging with stakeholders. Part of my role is the website and social media. It's just such an easy way to engage with wide audiences.
Ultimately, my role is to take care of the digital aspects of the organisation, and that includes the social media and the website mostly. There are some other online aspects to it, but also I'm the graphic designer. So I make things look pretty for everybody, but also handle some of the video and audio aspect as well.
My role as human resources officer is to support the employee lifecycle. That includes recruitment, onboarding, talent retention, performance, and offboarding.
So my role involves working with multidisciplinary teams, the Queensland Health, RFDS, public clinics, and Apuna Pima in providing chronic condition support for our chronic conditions clients, integrated team care, coordinating care, getting supplementary services to them, and making sure that they can navigate the healthcare system.
We work in Cape York, so we do a lot of health promotion, community education around tobacco control.
At the moment, my role as a health promotion officer lead is to lead our health promotion team, and our health promotion officers go out to the Cape York and service our Cape York communities. We do a number of things in health promotion, whether it's from social environments, creating behaviour change through delivering of education, school programs, women's groups, men's groups, education sessions.
A good day is a full day. Emails, phone calls, meeting people, establishing networks, talking to external stakeholders, speaking to RTOs, developing training programs. We enroll people from Cert 3 all the way up to a Masters and everything in between. If there's no training out there, we create it. So if there's cold chain management or medical terminology, etc., we create that. So
My favourite part about the job is the team. So strategically planning, may it be for our programs, resources, school holiday activities, it's all product of everybody's vast knowledge and experience, and that makes us be able to give the best service that we can for the young people while making it a positive and enjoyable learning experience for them as well.
Seeing people's lives change for the better and the little wins. Just every time you successfully get someone to quit smoking, or their diabetes is better controlled, or actually improve someone's quality of life and made a difference, fixing a problem like flushing out an ear and they can hear again. Simple, always easy. and rewarding because you've actually fixed the problem.
I love the collaboration work I have with everyone within our team, and just getting to know everyone on a professional level, and just meeting new people. Also, because I'm a third year full-time student at James Cook University, a lot of what I do here aligns with what I study at JCU, and that's Bachelor of Business, majoring in Human Resources.
What I love the most about what I do is fostering a really supportive atmosphere for our mob, and also providing them a top-notch patient care as well. And I can confidently say that the team here at Mackay Family Health really do thrive in delivering that.
The best part about my job is knowing that the knowledge that I've been trained from the health workers, I learned from the patients, the doctors and the nurses and specialists, is that sharing that information with every other patient too, so that we're all doing the right work. The patients are they're doing the good work at home, doing the self-management, and that they're capable of getting that confidence to look after their diabetes, attend their appointments for the optometrist or the dentist, cardiologist, endocrinologist. So it's passing on important knowledge to them, because then they pass it on to their family members too, keeping that knowledge and passing it on to the next family members and everyone's families as well.
Best part about my job, I think just working in a space where you know you're contributing to improving the lives of others, and working with others who want that too is really motivating and empowering. Every single staff member genuinely comes to work to try to improve the lives of people in need. So I think that's really special.
My favourite part of the job is that I know I make a bit of a difference, where I know that I am creating a message for those out in community up in Cape York, so that they understand more about health issues they may have. Knowing that I am helping get the message across in terms of health issues, that's pretty cool. Also, the cream, or I should say the cherry on top, actually travelling to community. Every community is different, beautiful in its own way. Just seeing your work at work, it is very fulfilling, yeah.
I enjoy the diversity of our work and getting the opportunity to welcome new employees into the organisation. It's rewarding getting to watch them grow and develop in their positions and supporting them as they go along in their journey. Apuna Pima has been really supportive with my professional development and dedicated to it while I'm studying at university. It's a really interesting place to work because we get to service some of the most beautiful, remote Aboriginal and Torres Strait Islander communities in Cape York.
So my favourite part of what I do is getting outcomes for community members, and at the end of the day, seeing the smiles on their face when they're able to be a bit more mobile and join back in community activities.
There's a few favourite things for me, but the main thing, my favourite part would be working with community and delivering our messaging and seeing it resonate with people. I love creating spaces for people to share their stories, their real life stories, especially talking about, smoking and vaping, stuff like that. It's really rewarding for me to listen to people share their stories about how they've quit or how they're making small changes to better their lives, and to empower them to make small changes or big changes and help them and encourage them to live healthier and longer lives.
There's so many favourite parts about my job. I love listening to stories. It's about finding that connection with community and the people that are there. There's all these forming of connections, who you are, where you come from, where you belong. And there's always seems to be a family connection wherever I go. I guess it's one of the things that we call the ripple effect. So if you can make it just a difference in one person's life, that's the ripple effect that will continue ongoing.
The favourite part of the job is that you're actually giving back to the communities. It's working in your own community. The favourite part is also travelling on country, having that good yarn with the mob from community, catching up with old friends, old schoolmates. We went to boarding school together, hadn't seen each other for years. So that's the best part of the job, is that you can make new friends, you can reconnect with old acquaintances, and then you can actually use your skills and knowledge and experience to better their lives in community. And then they can turn around and say, gee, I didn't know you do that.